Hi everyone, I'm Evan from Capillary Physical Therapy. I'm here again with Drew, lying down as my patient here. So we've been going through a series of videos that have helped to bring some light or identify some of these connections between the lumbar area, the pelvis, and the hip. So as we've gone through in the past, we've already talked about some of the innominate positions or structural kind of compensations that can happen. I've shown you in one of the videos that Haruska adduction test from the Postural Restoration Institute, which talks about stabilization and coordinating muscles. And this is another example of a test that we might use to help identify some weaknesses or restrictions in certain areas of your body. Specifically, we're going to be doing a bridge march test to help identify which group of muscles are really good at keeping the pelvis stable, and also looking at the coordination of that area from your trunk all the way down to your hips and pelvis. So what we're going to do during this test, I'm going to have Drew go through a series of movements. I'm going to talk them out to you so you can see what it is we'd be looking at and why. So the first part of this test, we've identified already that this is an area we want to assess and want to look at. And we know that it's safe for Drew to go through this bridge. So bridge up on all the way through here. So we're looking at how well do those hip bones or the pelvic bones kind of stay neutral. So we're looking at symmetry. We're looking at this being able to identify, is it going to rotate one side or the other? So he does a very symmetrical bridge here. So what I'm going to do is in a second, I'm going to have Drew lift his left leg. We're essentially going to be looking at the glute on the opposite side along with some of those other stabilizing muscles of the trunk and spine. So as he lifts this left leg up, go ahead, you can see that everything again stays nice and neutral. He's not letting one drop. So we're going to make sure that again things stay as they are. So again, he's using his right glute right there. So now what we're going to do is we're going to work on lifting his right leg, which is going to again identify how that left glute works. And right there you can see that same side of the hip just drops right down. So he's unable to coordinate that really strong glute contraction on this side, which would otherwise keep him nice and stable here at the hips. So this would be something we would use to help identify, again, an area that we would want to look at. So already I'd be thinking, looking at his hip a little bit more, looking at his glutes, also some of those muscles up the chain to see how well he coordinates it. So again, one of those tests that we might use, it's one that you can do at home pretty easily. So I'd ask you, go ahead, try this out yourself. If you're finding that it's a difficult position to maintain or hold, or you're finding cramping in your hamstrings and not stabilizing in the glute, or you're feeling your back turn on too much, it's often an area that we would want to say we'd want to work on your hips a little bit more, making sure you're not compensating too much with another area of your body. So if you're doing this at home and you feel it in your back and your hamstrings, or you're finding you can't keep that pelvis nice and stable, give us a call, come on in, let's help identify what we can help you with, and see if we can make this in a much more stable posture and hopefully avoid any future injuries or pain.